Hello, today my video is entitled What is Anxiety? I'm going to be talking about anxiety and its physical and psychological components, and then I'm going to talk about when anxiety becomes too severe and becomes a disorder, and mention a few of the common anxiety disorders. Anxiety is a symptom, not a diagnosis. Everybody feels anxious from time to time, and it's completely normal to feel anxious if you're going to have a job interview or an exam or see a doctor even. Some anxiety is good for you and helps you to perform well and be alert. It also gets your body ready to run away from danger if you need to, or to fight. Everybody has a low grade and background level of anxiety. Some people have a more relaxed attitude to life and have a lower level. Other people are more uptight perhaps, and are more cautious and risk averse and may have a higher level and background level of anxiety. When people feel anxious, they feel uncomfortable, uneasy, tense, worried or fearful. This is particularly so when something's about to happen in their life, or they think that something's about to happen in the future. There are a whole range of physical and psychological symptoms that people may experience when they're suffering from anxiety or feeling anxious. These won't be the same for everybody. So some people experience some of them, others, and there may be some symptoms that I haven't mentioned at all. The physical symptoms of anxiety can come from many of the different systems in the body. Your heart rate might go up and be particularly strong. This is called palpitations. Some people feel breathless and might breathe faster. You may experience pins and needles in your hands and feet and lips. You might feel dizzy or lightheaded. You might feel trembly and shake. You may have abdominal cramps or feel sick, nauseated, or suffer from diarrhea. You may have muscle cramps or pains in the muscles or headaches. So there, as I said, there are quite a variety of different physical symptoms. And with all those different physical symptoms, one can understand that people may worry that they've actually got a serious illness from the different anxiety symptoms they're suffering. And of course, this will make the person's anxiety even worse. Going on to the psychological symptoms, people who suffer from anxiety may have a sense of foreboding, or that something bad's going to happen, a feeling of impending doom. They may feel tense, irritable, making it difficult for them to relax. They may have a real fear of the future and worry what's going to happen. They may worry that people are looking at them and know that they're anxious. They may feel as though they're unreal, that they're separated from their body and are looking at themselves, and that's called depersonalization. They may feel detached from the world or reality, and that's called derealization. People also sometimes worry that they'll make a fool of themselves or embarrass themselves or do something inappropriate. They may feel as though they're losing touch of reality or losing their mind. So in summary, there are many physical and psychological symptoms of anxiety, all of them very unpleasant. Feelings of anxiety can become a problem for you when they are too strong, or when they continue even when you don't need them anymore. If you feel anxious all the time or for no apparent reason, it can make you feel uncomfortable and can impact on your daily life and stop you doing what you want to do. If you find as though you feel you can't manage to get to work, or you're keeping away and isolating yourselves from your friends or family, or avoiding things that you would normally want to do but at the time are feeling anxious about, all these things can be symptoms of a anxiety disorder. Anxiety is the main symptom of these disorders, and that's why it's called an anxiety disorder. Common anxiety disorders include generalised anxiety disorder, GAD, which affects 5.9% of the adult population in England. Also included under this heading, under this umbrella, are panic disorders, post-traumatic stress disorders, obsessional compulsive disorders, agoraphobia, and social phobias. Thank you for listening. Bye.